And welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Kathleen Muldoon, physician coach and medical school professor. Today's Kevin MD article is How Motherhood Reshaped My Identity as a Scientist and Teacher. Kathleen, welcome back to the show.
Thank you. I'm so honored to be here again.
All right. Tell us what this article is about.
So this article came to be in May, right? And I think that's important to notice because it's a time when a lot of us are kind of wrapping up our academic or fiscal year, and we have these evaluation forms that we have to fill out, kind of checking boxes about who we are and what we've done. And I was sitting there in front of my laptop, right, with the flashing blinker and all those things, and looking at this and noticing, like here we are in May, I'm filling out this evaluation of my year, and Mother's Day is in a couple of days. Mm-hmm. And, for me, thinking about who I am professionally and how that intersects with motherhood, I think that, instead of filling out my form, I wrote this piece to kind of put myself in that place where I can see, like, I am both a scientist and a teacher and a mother and a caregiver and an advocate. And, when you see these forms, and I think what we are trained to do in academia, in medicine, in training, is this idea that, you fill the boxes. Mm-hmm. But I don't see myself in a lot of those boxes. And in fact, through my particular form of motherhood, I've had to learn to bridge some of those boxes. And it just brought out a reflection in me that, I think that our conceptualization of how, caregiving, and I use motherhood because that's my framework, but, any kind of parenting or anything in our personal lives is seen as extracurricular. And a lot of times that actually makes us who we are. And we bring that with us into our professional lives. And I just wanted to kind of bring up some questions around that. So that's where that piece came from.
All right. So tell us how all your professional, or how all your identities, both professional and personal, how do they intersect, and how does one draw from the other?
So, my PhD is in anthropology, and a lot of us end up in medical schools teaching anatomy, teaching, various different forms of professionalism and things like that. And, so I've been teaching in med school for a long time, and embryology had been my teaching specialty. And in the process of doing that, I had a son with a significant amount of medical complexity. He was born with a congenital cytomegalovirus infection. And even though I had been co-teaching with physicians, pediatricians, OBGYNs, I knew that cytomegalovirus was the C in the torch screen, but I didn't know anything else that was probably more relevant to know about it, about the dangers to pregnancy, about how to avoid transmission. And so I was suddenly thrown into a space where I had one foot in the disability world, one foot in medical spaces, and now also being thrown into medical spaces that I hadn't known before as a caregiver mm-hmm. to a significantly disabled child. And so, call it intellectualization, call it what you want, but I stepped into this space where I was like, I have this language, I can read this literature, it's within access, and I see that we're not talking about this the right way. And I experienced, there's a known lack of knowledge about this virus in healthcare providers. And so I experienced that academically, and I experienced it in terms of accessing care for my son. And so because I couldn't find a nice set of bridges, in all of these different boxes, I had to become that, right? So I found myself like advocating, right, for better education for CMV. I found myself advocating for my son. I found myself advocating that we incorporate it into undergraduate medical education and resident training. And because I had access to all of these spaces through my professional life, my passion for it came from my personal life. And there was just blending. There was blending because there had to be, through this new role in advocacy that I found. And, I wasn't advocating for my particular son's services, although I do that too, right? But those skills that I bring to, and the passion with which I talk about it, informs when I am in those training spaces for med students, residents, doctors, the pediatricians and OBGYNs and otolaryngologists who see CMV firsthand and still don't have that lived experience perspective. And I think that the same questions that I ask when my son's in the clinical setting, when I'm in the IEP, when I'm teaching to my students, like I'm honing those skills of how to ask questions. And so motherhood and caregiving is where I hone those skills, and then I bring them with me everywhere. So to me, that's where I see that the gaps fit in. I'm not invited into, I do a lot of advocacy work at the state and national level, and I'm invited to those spaces as Dr. Muldoon, who happens to know a lot of this stuff professionally and has the lived experience that she can bring to share to add that passion. I don't, it's very different than, when I'm bringing those skills, I'm invited into these spaces, then, can you bring your son along and we're going to use him as a patient case? Like that's that's like mom only, right? Mm-hmm. But what I see and what I think I share with a lot of your audience, right, is that there are these parts of our personal lives that actually hone how we show up professionally. And I just think we need to honor that.
So give us an example of that. So let's say you were talking about CMV, cytomegalovirus virus, in a medical education setting. So what would be an example of some of that lived experience that would inform your teaching and that you would share with the people that you were teaching?
So for me, a good example is, CMV is not a typical part of undergraduate medical education. It's not even, I think, in most, professions that do intersect and have the opportunities to advise women about the dangers of contracting it during pregnancy is not a formal part of training. And the, advising bodies have waffled on whether this should be mandated to be part of, for example, prenatal visits, right? So a personal, story that I can share and that many people have shared with me because I am open about my lived experience is, saying something that is factual. So CMV can live on our surface for up to 6 hours. Mm-hmm. So, while you're pregnant, you should be careful about sharing food, which is a surface on which CMV can survive, washing toys, in addition to the things that we normally think of as just good pregnancy hygiene in terms of washing hands, after you change diapers or wipe a face, but those casual, good parenting kind of interactions that include, kissing your kid when they're like upset and they just have all sorts of bodily fluids on their face, right? So, I've been in situations where I personally have been told like, well, that's not a risk for contracting it during pregnancy, right? Where it's just like a factual, it's just misinformation. And because you just haven't, a clinician hasn't intersected with that part of CMV natural history in their training. And so rather than say, I don't know, or let me look that up, or even listen to my experience as a caregiver and as actually, someone who is the chair of the scientific advisory committee at the National CMV Foundation and co-founded Stop CMV AZ here in Arizona, to have the what I'm up against there is that notion that physicians can't, or I find it very difficult to say, I don't know, right? Yeah. Because there is this idea that engenders distrust, but actually that makes me trust you more, right? So what I can do is bring that story into educational spaces and say, like, here is a reason where not saying I don't know actually can cause harm, right? And actually can, cause distrust, because if somebody goes to the literature and they say, well, this isn't right, or other trusted messengers, which especially in these spaces of caregiving, trusted messengers include people who are living the experience and are ahead of you in the journey. Why not partner together? This is a great example of collaborative care, right? So that's how I can use that experience and either put myself into it or just say these are things that happen commonly that are reported to me in my professional roles in these advocacy groups. What can we learn from this in terms of your own professional identity formation as medical students, residents, people working in the fields in which they can affect care for CMV?
Now, as you know, medicine hasn't traditionally been the most receptive when it comes to blending the personal to professional. There's always a clear line of demarcation. So sometimes those identities can't be separated, as you shared in your story. Have you run into any headwinds or obstacles when expressing yourself as a single identity rather than being these separate compartmentalized components?
Yeah, I have. The short answer is yes, I have. And I want to be part of the change for that, right? And I think, like, in my own life, I am very clear. Like, I am taking PTO right now to take my son to a clinic visit, right? Versus I am being invited to help advise senators on the Stop CMV Act, which would increase funding for CMV screening in states. So in that case, like, I am in a professional role. Do I know about CMV because I'm a mom? Yes, right? So I think that, if we take a broader look back, this has been happening for a long time. Like, why do people go into research on Alzheimer's disease or, cancer research, right? It's hard to say that people aren't passionate about their research because of some personal connection. And I think what we need to do is take a step back and say, this idea that I wear a whole bunch of different hats, right? And I have bought into that myself. Like, I'm swapping out my different hats now. Like, now I'm a mom, now I'm a caregiver, now I'm this, whatever. But it's not really hats that we should be talking about, I don't think, in my opinion. I think there are lenses, and these are lenses that sharpen each other, right? And so the knowledge that I gain about how do I speak about hard things when I'm advocating for something personal for my son are the same skills that I take into asking questions when I teach a humanity and medicine class, which is an entirely a course about courageous conversation. So I do meet resistance, and I am happy to meet that resistance and have the hard conversation and think about, like, maybe what would it be like if we thought about things a little differently. And I want to say one more thing, and that is just, when the pandemic hit and we were all relegated to these little boxes, which by definition blended our home and work lives. I mean, that's an opportunity to rethink, like, how do we rethink how we show up, and how do we handle all these things, all these balls, all these zooming between, Zoom meetings and Zoom school and, clinic visits and all of the things that we've had to do and that your listeners have had to do. That resulted in a skill set. And so thinking about, moving that forward, what does that mean for a more humane, whole person centered medicine is, I think, really important right now.
What are some examples of what that resistance looked like?
So I've had examples where I have filled out the, end of year evaluation forms and, received some questions as in, please indicate which of these were personal obligations versus professional. When, clearly there were places where I had an invited lecturer or keynote speaker, was a representative of my workplace. On the other side of it, I have been invited as a keynote speaker at infectious disease conferences. I've given more than 200, invited lectures internationally. As, Dr. Muldoon, I published a lot of papers on data that I've collected about caregivers' experiences with CMV, how you, go from advocate or from diagnosis to advocate, what do clinicians know and not know about CMV? So data measured using my anthropology data skill set, ethnography, all of the things. And I'll be presenting. And then, in the question and answer period, I have even had, and I'll give you one very specific example. I was presenting at this infectious disease conference, and I have 3 children. My son infected by CMV is my middle child. So I was pregnant with my 3rd child. I'm very visibly pregnant at this time when I was giving this presentation. And the question that I got from the audience was, CMV is not really that big a threat. Stress is more dangerous to a pregnancy than this virus. So I pushed back and, with all of the evidence. And then the question that came back was a hard kind of look at my body up and down. Like, this person was visibly taking in my pregnant belly, and they said, well, where did you read that? What to expect when you're expecting? So just cutting down my expertise. And I said, no, the New England Journal of Medicine, JAMA, all of the PNAS, all of the places that we know. And then, another example of how these things go together, I walked out and cried hot tears in my car because it was totally inappropriate and unprofessional in my opinion. So another example where I wasn't accusing anybody of doing anything wrong because they didn't know. I was just like, here's the evidence. Like, we need to be talking about this more, and to experience that as a challenge, but not take that in as like, I don't maybe I don't know this. Maybe I need to look into this. Where is that feeling coming from that I, instead of taking that in, bring this speaker down in this way. So those are just two examples that come to mind.
You open up the article by talking about the term mother scholar at first. You thought maybe it would have been a curse, but then after reflection, of course, it's a statement of who you are. So talk about how important that term mother scholar is to you.
I love that term. It's so weighty. I just love like the words that like just sit hard in your mouth, and that come out. But I think it's like pairing those identities as intersectional and as informing each other and owning your wholeness. And so for me, it is very specific about being a mother. And through that terminology and through some work, I have co-published with other parents, especially parents who are raising children with disabilities and, female parents who identify as mothers, and thinking about how those co-identities actually inform our work, and have moved us into spaces where we're more intentional about like, what questions are we asking? But I think that that's true in, it's a very specific term to my situation, but I think, the experiences that we often feel like we have to hide as part of our professional life, as you referred to before, that's actually where we probably learn to be the most human, right? And are most transformative for ourselves moving forward. So to me, that's what it represents. Like, I am a mother. I stand in these two spaces simultaneously, not hopping back and forth like between one and the other, but they co-inform who I am in all spaces when I bring my whole self. And that is very important, I think, to me and for medicine to reckon with.
We're talking to Kathleen Muldoon. She's a physician coach and medical school professor. Today's Kevin MD article is How Motherhood Reshaped My Identity as a Scientist and Teacher. Kathleen, let's end with some take-home messages they want to leave with the Kevin MD audience.
Well, I think if there's one thing I hope listeners take away, is that, caregiving, and for me in particular, but anything that's kind of a large part of who you are outside of the clinic, outside of the classroom, isn't a distraction from professionalism, but it's like where a deep well of knowledge and strength can come from. And whether you're a clinician, an educator, or a caregiver yourself, the experiences that you often feel like you have to hide, maybe question that, right? And think about how they inform who you are and why you have the role and the power and the relationship that you have with your students, with your clients, with your patients. And so, thank you, Kevin, for the space to share my story and to be in conversation with so many people who I think are living quiet versions of this same issue every day.
Kathleen, thank you so much for sharing your story, time, and insight. And thanks again for coming back on the show.
Thank you.